My name is Phil Anderson. I live in Pocatello, retired from the Idaho National Laboratory about 18 years ago. I continued to jog quite a bit through my 60s and very early 70s. My knees started to hurt. I was referred to an orthopedic surgeon who took x-rays, examined it, and bone on bone was the terminology I heard, and that I could either have some injections that would alleviate the pain temporarily. There was replacement surgery, which is most common, and I know it is effective, even though the recovery process could be miserable. At my age, I wanted to avoid surgery, and my orthopedic surgeon did say, well, regenerative technology also is a possibility. So I did some searching on the internet, attended a couple of seminars on stem cells, and even though I was largely skeptical, especially since my medical insurance coverage absolutely wouldn't touch it, but after meeting with Dr. Wurick, I was confident enough that I thought I should try it. The injections were absolutely painless, and within a day, I have not since had any pain in my knees. Not just only a little bit, but gone. Now, 3 months later, I'm functioning essentially normal, and compared to where I was, I'm feeling so well that I really don't want to push it, take a chance. I just want to keep it this way, but I am entirely satisfied, pleasantly surprised, and no complaints whatsoever. Thank you for the opportunity to share.
My name's Glenn. Had my left shoulder was bothering me, had given me some fits while I was working and stuff, and so I came in here and Dr. Wyrick took care of me, gave me an injection, and took a couple weeks, and the pain is gone completely. It's awesome.
All right, so Benny, how long has it been?
Been 1 year.
1 year. How's the shoulder doing now?
Great.
Hey?
Yep.
That's awesome.
Yeah, I am happy.
So, if you're happy, then why are you back?
For a booster,
Okay.
which I didn't know. You just recently started offering yourself, so I thought, well, the first one the stem cell went so well, why not go a booster?
Right.
And then kind of put half of it in the other shoulder because it was doing a lot of the work while the other one was recuperating from the stem cell.
Awesome.
Yeah.
So it's been a year.
It's been a year.
How much work did you miss?
None.
That's awesome.
Yeah.
I appreciate it, Benny. Thank you.
You're welcome.
Hey, welcome everyone. I am Dr. Brady Wyrick, and welcome to the webinar. Before we take off here, I do like to cover a couple things with you, and there's a disclaimer I'd like to go through. Number one, regenerative medicine, the things that we talk about tonight, they are not approved by the FDA. But you can rest assured that they are cleared by the FDA, meaning they are monitored, they are regulated. The FDA just has not approved anything that I have said or anything that I say in this video or in this webinar, excuse me. So it's not FDA approved. Because it's not FDA approved, it is not covered by insurance or Medicare. We do get a little into pricing tonight so that you can see what that's all about. And then number three, our medical staff performs all of the procedures. I have nothing to do with the actual procedures themselves. My job in this is to educate, to teach you how to take care, or what your best options are, and then it's up to the medical staff to administer the therapies and go from there. Number four of the disclaimer is that no babies are ever harmed in our procedures. There's a lot of misinformation out there about stem cells coming from embryonic tissue or stem cells coming from fetal tissue, from aborted fetal tissue. None of that is true. These cells that we use all come from donated umbilical cords. They are umbilical cords that come from healthy moms, healthy babies that have consented to donate their material so that it could be used for the purposes that we're going to talk about tonight. So those are the four disclaimers I like to cover from the beginning. I'm going to take a step back and give you what my goals for this webinar are. Number one, I want to educate those who are wanting to learn more. I know there's still a lot of you that are in that research phase, that you are wanting to get more information. You're trying to figure out what's best for you. That's awesome. I welcome you. I'm here to give you that information. For those of you who are ready to take the next step, I have an offer for you at the end. So if you're ready to move forward, then I want to set up a consultation so that you and I can talk about what your options are. So hopefully what we can do is take those people that are here for number 1, move you to number 2, and let's see how we can help you the most. So stick around, because that offer will be at the very end. So here's my background. Hey, my background is I've spent the last 13 years here in Southeast Idaho serving the community. Hey, I've been in practice for about 13 years. 11 of those 13 years I've been in the field of functional medicine and functional neurology. So yes, I am a licensed chiropractor. Yes, I'm board certified in chiropractic neurology. Yes, I've practiced functional medicine, teaching people how to eat. So basically for the first 11 years of my practice, it was all about helping people with chronic disease by teaching them how to do exercises for their nerves to make them stronger, and teaching them what to eat to make their bodies stronger as well. That has been my background up until about a year and a half ago, is when I transitioned into regenerative medicine education. And the reason why I did that is because the research, the things that I was seeing about stem cells, stem cell therapy, that I couldn't ignore that research anymore. I knew, it didn't matter how much I did for people. When it came to osteoarthritic joints, we were still having to send them out to have joint replacement surgery. And we didn't like that. Yes, it has helped a lot of people, but it's also been, for those people it doesn't work, we want to do everything we can to make it so you don't have to go through that. That was really my transition into this particular field. And again, my job here is only education. It's up to our staff to actually, in our medical team, to administer the therapies that we talked about tonight. Speaking of those therapies, we've done this for over 250 people now here in our area, and from people all over that fly in and travel in to see us. And what I'm here to do is actually share with you what we've learned. The results that we've gotten have been phenomenal, and that's due to a couple of different reasons. Number one is, first and foremost, it's been my staff has been absolutely amazing. Our medical staff is second to none. They've got I don't know that there's anybody in Southeast Idaho with the experience that they have. And secondly, our therapies have evolved over time. They've gotten better as we've done this. And then thirdly, the labs that we use are, in my opinion, the absolute best. They are FDA regulated labs because safety is number one. And that's those are the things that I'm here to share with you during this webinar. So speaking of my transition into this field, it had a lot to do with this guy here. I've got a few real world stories I want to share with you. Some of them you saw in the beginning during that video. But this is my dad. And about 2 years ago, Dad was scheduled to have both of his knees replaced, and that was right at the crux of me putting together what I needed to put together to be able to make this happen. And Dad, his knees were both bone on bone. They were supposed to be replaced. And he was actually one of the very few people that we see that feel better getting off the table right after his injection. So he canceled his knee replacement surgeries. If you fast forward to today, he makes jokes about not needing his knees replaced anymore. And he's actually quite active now. Just a couple weeks ago, he was in Sun Valley, where he rode his bike 27 miles and didn't have any knee problems. So it's been phenomenal for him. That's great for my dad. What about real people? We're mounting more and more testimonials as time goes on. I do my best to share those on my social media feeds. They are found on my website at iamregen.com/testimonials. You heard a little bit from Glenn in the beginning video. Glenn, I love his story. Glenn is in his mid-50s, and he's in the Idaho Air National Guard. And he is a crew chief in a Black Hawk helicopter. Actually, it might be Idaho Army Reserve. I think I'm getting that mixed up. But either way, he is a crew chief in a Black Hawk helicopter. And that's his, he's in the reserves. His day job is with a local utility clinic or utility company where he provides services. But his shoulder was wearing out. And with his shoulder going, he wasn't sure he's going to be able to pass his PT tests. And if he can't pass his PT test, that means he can't fly. And if he can't fly, it means he can't sit in the back of the helicopter, shoot the machine guns, rappel out of it, etc. That was not okay with him. And having to do a replacement surgery meant that he was going to be out, again, missing that PT test, and he just didn't want to go there. We injected his shoulder, and within 2 weeks, he was doing very, very well. And as I said in the beginning, as our procedures have improved, we're seeing more results that are 1 to 2 weeks versus 6 to 8. So we were happy with Glenn. That was one injection that he did. This is Rudy. Rudy's story is also really awesome. Rudy is a business owner here in Idaho Falls, and his shoulder was also wearing out, and it was keeping Rudy from exercising the way he wanted to. It was keeping him from sleeping. It was a really big issue for him. We injected the shoulder, and again, he's doing really, really well. And the video that he shared with us was awesome. So we were happy about Rudy as well. This is Anna. You'll hear a little bit more about Anna later. She was one of our more systemic patients that we see. She had something called psoriatic arthritis and fibromyalgia, and we gave her an injection that has helped, in her husband's words, give him his wife back after 10 years of her being very sick. So we were happy for Anna as well. So those are just a few stories of the many, many that we've seen. I know you're thinking, that's great. Well, what about me? Well, the what about me comes into the actual consultation part of this. We really don't know how it's going to work out until we talk. Let's see if you're a good fit. And that's why I've said, hey, if you hang on with me till the end, there will be an opportunity that we can talk. So that being said, there's several questions I know you want answered. There's several questions that I want to answer for you. That first question is, what is regenerative medicine? And the by the book answer, I think I got this from Wikipedia. Regenerative medicine is a branch of translational medicine that deals specifically with the regeneration and growth of key cartilage and tissue. So the word translational means you take one cell type and turn it into another, and regenerating and regrowing new tissue. And if you look at that picture down there below, in fact, I'm just realizing that my video or my face is probably covering the picture, but the knee on the right side of your screen is a degenerated bone-on-bone knee. The knee on the left side of your screen has gone through the medical standard of care, which is give them drugs, inject them with steroids. When those stop working, then you have them replaced. We want to help you avoid that from happening. And we have seen this a couple of dozen times in counting, where people actually just cancel their replacement surgeries. In fact, I was just having a conversation with one of my colleagues that we look forward to the day that having a stem cell injection is requirement before you actually have to have surgery. I don't know how far away that day is, but it's not here yet. But for our definition, what we do is we utilize PRP, which is platelet-rich plasma, umbilical cord-derived stem cells, and stem cell exosomes instead of drugs and instead of surgery. And by doing that way, if we can put off having to have surgery, if we can give your limbs more mobility, give them less pain, give you the opportunity to get back to doing those things that you love, I think there's a tremendous amount of value in that. But those are the tools that we use. So that brings up the other questions I'm going to answer for you. What is PRP? We're going to talk about what is a stem cell and what is a stem cell exosome. Who can regenerative medicine help? And then we're going to ask that question, is regenerative medicine right for you? So that's the direction we're going to go for the next few minutes. Let's start off with what is PRP? Okay, PRP stands for platelet-rich plasma. This is you take your body's own blood. So that hand that you see on the screen right now, that is Amanda's. She's our office manager. That is an actual vial of our patient's blood. And what we do with that vial is we take that vial and put it in a centrifuge, and we spin it for 5 minutes at 3,600 RPMs. And what that does is it separates the blood, or the red blood cells, from the plasma and leaves the platelets in the plasma. Then we can take that yellow you see here on the picture. All of that yellow is plasma, and it's full of those platelets. We take that, we inject that either as a standalone, or we do it with stem cell therapy. And that PRP is absolutely just loaded with growth factors and cytokines and the building blocks that your body needs to stimulate its own reparative response to help you regrow and regenerate new tissue. So PRP was an awesome addition for us. We were super happy to have it here. We continue to do really well, and it's one of the tools that's actually given us that we're seeing results a lot quicker. Now, they actually can act. They can act to guide your own stem cells. So if you do PRP on its own, it can use your own. It can guide your own stem cells, or it can do that from a donor to generate, to recreate, and to I need to do some editing on this here, to help you regenerate that key tissue that we talked about. So PRP certainly falls in line with regenerative medicine. So that's PRP. So let's talk about what is a stem cell. A stem cell is your body's own reparative mechanism. It's a blank slate cell. That definition was given to me by one of our patients when he called it a blank slate cell. And I think it's absolutely phenomenal because it makes total sense. If you think about a blank slate, what does a blank slate do? A blank slate is literally just a blank slate that you can do anything with. So right now, hanging out inside of your bone marrow and inside of actually it's inside of every tissue, you have these blank slate cells that are ready for your body to use to repair in the case of injury. So on this particular picture here, this is a slide that really changed it for me, that changed my career. When I saw this, everything just absolutely made sense. Up at the top of this, there you see the mesenchymal stem cells. Hey, these are your blank slate cells that your body holds in reserve so that when you get injured, these cells have the ability to go where they need to go and to become what the body needs them to become. Now, if we're talking about adult stem cells, then we're talking about only being able to become certain tissue. And you see down here at the bottom, if you get injured in the bone, then that tissue becomes bone. If you get injured in the cartilage, then the tissue becomes cartilage. Muscle becomes muscle. I could keep going, but I won't. I think you get the idea. So when you get injured in your thumb, your stem cells are released to go and to become thumb and to actually recreate and regenerate that process. So now what we're talking about is the ability to augment your body's own reparative mechanism to start repairing and regrowing whatever sites are injured. So stem cells, they have three main purposes. Hey, the first thing that they're going to do is they are anti-inflammatory. So they're going to show up at the site of that injury and start knocking the inflammation down. The second thing they're going to do is they're going to start to modulate your immune system and control your immune system. In fact, you should write these down because I think they are vitally important. They do modulate your immune system. And then lastly, they start to regenerate and regrow that new tissue. Okay, so again, when you get injured, your body's own stem cells are released to go to the site of that injury and start repairing whatever that injury was so that you can heal. How cool is that? Now, I know a lot of people think at this point, well, if I have this awesome reparative mechanism, why isn't my body healing itself? And the issue becomes your age, because as you age, the number of stem cells that you have decreases dramatically, and the rate at which they replicate decreases tremendously. Okay, so if you look at this chart, 1 out of every 10,000 cells, when you are a newborn, 1 out of every 10,000 cells that you have is a stem cell. But as you age, that number drops all the way down to 1 out of every 2 million. But it's not just a quantity game, it is more of a quality game. So yes, you can use your own stem cells. It is an option, but the older you get, the less of an option it becomes. And I jokingly say this with people, is if you, the more gray hair that you have, the less likely those stem cells are to regenerate and regrow. So here's an example of how quickly they replicate. At birth, your one stem cell divides every 28 hours. So if you're talking about an umbilical cord stem cell, its replication rate is every 28 hours. That means that every 30 days, one cell can become a billion cells. Hey, when you hit the age of 40, then the replication rate drops down to 48 hours, which means at the end of 1 month, at the end of 30 days, you get 32,000 cells. And then you hit the age of 60, then that replication is all the way down to 60 hours, meaning you only get 200 cells at the end of 30 days. So when it comes to using your own stem cells, yes, it's an option, but it's not just a quantity issue, not just a quantity issue, it is a quality issue because those cells may not replicate as fast. But if you feel like using your own stem cells is the best option for you, you have my blessing. Go do it. You are going to spend more money, and there is a less of a chance of it working for you because of these issues. So that takes us to this word. What is a stem cell exosome? I shared before, I said the three things that stem cells do is, number one, they're anti-inflammatory. Number 2, they regulate your immune system. And number 3, they regenerate and regrow new tissue. The reason why they do this is because stem cells secrete something called an exosome. Exosomes are the literal secretion of stem cells. It's what the chemicals that they release that include messenger RNA and other proteins that will go to the site of the dying cell, and they will give that cell instructions on what to do and how to regrow themselves. So when you ask what a stem cell is, this guy up here in the corner, this big purple and blue guy, is the stem cell. These little green extraterrestrial, it's like I'm watching ET. These I can't talk. Extracellular vesicles are released. These are the little chemical messengers. These are the stem cell exosomes. So if we look at this in terms of generations, about 10 years ago is when we started using your own stem cells to start to regenerate and regrow, for example, knee cartilage. That's what we call a first generation biologic. You fast forward to about 5 years ago, we started using stem cells from donated umbilical from a donor, which are called allogenic stem cells. That is a second generation biologic, which are still very, very effective. But now we're into a third generation biologic where we're talking about these exosomes, which are the literal secretions of the stem cells that we now have the ability to isolate and to use as therapy for things that we couldn't do before, which is just, I can't even control my excitement about it because it's awesome. The things that these exosomes are tiny, tiny vesicles that easily cross the blood-brain barrier, easily get through the issues with the lungs, and have a more systemic effect than what stem cells ever did have. So that's what we're starting to see with exosomes. So that's what an exosome is. But what conditions? At the end of the day, what conditions can we help? Because I know that's what's most important. The number one thing that we're seeing is osteoarthritic joints, especially bone-on-bone joints. PRP and stem cell therapy work the best for osteoarthritic joints. It's a very simple procedure, provided that you have a staff that knows what they're doing. If you don't, then safety issues become a concern. And if you have good labs that you use, safety it makes it a more simple procedure. But this case is a 54-year-old male that walked into one of my friend's offices, one of my colleagues' offices, and the knee on the left side of your screen, you can see the space between the top part of the knee and the bottom part of the knee is about 2.8 millimeters. That's otherwise known as a bone-on-bone joint, versus the knee in the middle. I'm getting ahead of myself. The knee on the left side of the screen was injected with about 2 million stem cells, and those stem cells immediately started, and they were umbilical cord cells, so they within a day they had doubled. Within another 28 hours they doubled again, and they kept doubling until the picture in the middle was taken at 4 weeks after the injection. That joint space you can see is 5.3 millimeters. And then on the right, this is 8 weeks after the injection, had gone all the way up to 6.1 millimeters. So we were very thrilled to see results like this because they're growing new cartilage. They have less pain. But I think the most important thing, though, is that they're able to move again. And it's not just about doing the things that you want to do, doing the things that you love. It's also about your overall health, because moving joints are happy joints, and if joints are moving, they're going to feed your brain, and your overall wellness outlook is certainly improved when you're not in pain and you're able to do those things that you want to do. So they can PRP and stem cell therapy can also be used for things like tendonitis and tendinosis. I often joke around, you think it's like golfer's elbow, tennis elbow, etc. We joke around with people and say that if it ends with itis or osis, it is certainly something that we can help you with. A stenosis. Now, stenosis is a narrowing that typically happens in the spinal canal. We don't inject these directly into the spinal canal. We inject them into the muscles above. But we know that one of their effects is that they actually break down scar tissue. And so we've actually seen some people that have done very, very well with stenosis. They did not get 100% relief, but they got enough relief that they were very happy with the results that they had. Plantar fasciitis is another big one. Again, it ends in itis or osis. These are certainly things that are in our wheelhouse. Osteoarthritis of the spine. I'll say it again. We don't inject directly into the spinal column. We inject in the muscles above. And because these stem cells have the ability to seek out and to hone in on the areas that they need to be affected, then they get to the spine, where we're seeing some great results with the spine as well. This is a big one, sexual rejuvenation for both men and women. I think men get all the attention here with all the ED ads that you see everywhere, but stem cells can certainly help with ED. But the same thing with women. Hey, we're seeing things like bladder control issues that are helped, sexual dysfunction that's helped, dryness is helped with regenerative medicine. So sexual rejuvenation is something that's very, very important and can be helped with these particular types of therapies. Coming soon for our office will be aesthetics. We will be doing some hair growth and wrinkle reduction. We're a little ways off from doing that now, so we're going to focus on the other ones that we just talked about. That stem cell therapy can help you with. So that takes us to this great article. I love this. From 2014, they took 18 people and injected mesenchymal stem cells into their osteoarthritic knees. And what they found was that there was improved function and pain of the knee joint without causing adverse effects. In other words, it was safety. And it reduced the cartilage defects by regenerating cartilage. So they're actually showing that people are regrowing and regenerating new cartilage by doing stem cell therapy. Hey, this is Bridget. She's one of our awesome stories. We love Bridget. If you get a chance to go over to the Cabela's here in Idaho Falls, she works there, and she'll talk your ear off about stem cell therapy. But Bridget is one of those cases where her brother had a knee replacement, and she didn't want to go that direction, so we injected her knee. She gave us an awesome video that's on our website, but the short story is she walked away, or her brother walked away with a gigantic scar across the front of his knee. She walked away with a Band-Aid, and she was very happy with the results that she got. So we appreciate Bridget sharing her story. If you get a chance, go over and check out her video. So what can exosomes help with? What can mesenchymal stem cell exosomes help with? This is when we start talking about the more systemic issues that we see. We've already talked about Anna's case there on the left of your screen, but on the right of your screen is a psoriasis case that we saw where we did an IV. And within 14 weeks of doing the actual injection, you can see how much George's skin actually cleared up. But when it comes to asking that question, well, what can the exosomes help with? What can this therapy help with? What it usually goes back to are the three things that stem cells will do. Number one, they're anti-inflammatory. Number two, they control and modulate your immune system. And number three, they regenerate and regrow new tissues. So I will have people talk to me on a daily basis and call. In fact, just a few minutes ago, someone called and asked me about fibromyalgia. And I will go through and say, look, is there inflammation? Yes or no? The answer is typically yes. Is there an immune system component? The answer is typically yes. Is there tissue that needs to be regenerated? The answer is typically yes. Okay, now, our success rate when it comes to osteoarthritic joints is much, much higher. Okay, we're seeing numbers above 80 and 90%. Okay, but when it comes to more of these systemic issues, it drops down a little bit, but it comes down to the cells are going to go where your body needs them to go. The exosomes are going to go where the body needs them to go and repair what they need them to repair. So there are a lot of things that we have seen, but we want to talk about those other cases in particular just by going one-on-one, so we can talk about your case individual. But here are some of the things that we're seeing. Everything from chronic back pain. There's research on heart disease and COPD and everything else in the middle. So now that we've talked about what regenerative medicine is, we have defined PRP, stem cells, and stem cell exosomes. We've talked about the conditions they can help with. Now we're going to transition and ask that question, is regenerative medicine right for you? So the first thing we want to talk about is your overall health status. Hey, your overall health status does matter. Hey, it's the more medications that you're on, the more disease processes that you have, the worse your lifestyle is, the less likely it is to help you. Okay. Now, this is something we do need to talk about, and when we talk and do this consultation, we are going to discuss height and weight and medications because all of those things matter. So if you're coming to see me, or if we're going to do this consultation and we're talking about your knee and you're otherwise generally healthy, the chances of us helping you are very, very high. But the more stuff that we add in on top of this, the more medications that we're taking, et cetera, it does decrease our chances a little bit, but we're very open. We will discuss those things before we do anything. That's what we want to talk about during the consultation. Number 2 is your mental mindset. I'm half joking when I say this, but if you're convinced that this is a waste of your time and your money, then guess what? It's a waste of your time and your money. And I don't know why you're still on the webinar with us if if that's the case. But we preach this thing called hopeful optimism. We're here to do everything we can to help you get the best results that you can and to help you have this, hey, this might work out. This might be the greatest things that I've ever done. But if it doesn't, it doesn't, and then we just move on. So mental mindset does absolutely matter, and we'll help coach you through that the way. The financial part of this, the financial part comes down to if you can afford it, great, you need to do it. If you can't, then I'm going to tell you not to, because if you increase your stress levels because you're out of money, the chances of us helping are going to go down significantly. So those are some of the things that we're going to talk about during the consultation. But as far as the financial part of it, here's the cost. If we're doing PRP by itself, PRP starts at $595. If you're over the age of 50, doing this by itself may not be the answer. We may need to start talking about stem cell therapy. Stem cell therapy starts at just over $3,700, and that's for one joint. There are discounts to do multiple joints at a time, but that's where this starts. And then exosomal therapy using exosome starts at around $2,700. And during the consultation, we will talk about what the best fit is for you and where my best recommendations will be. But at the end of the day, you're going to be the one making the choice of what you want to do. Our payment options are cash, check, or credit card. We do have health savings account available. We have flex spending accounts, so you can use those. And we even have some financing options that you can use as well. So that's what the costs look like when we're doing this. But when it comes down to how much is it going to cost exactly for you, we do need to do that consult so we can see what the best fit is. Before we wrap up, I want to cover just a couple of frequently asked questions. Number 1, does it hurt? Well, you are taking a needle. But because we're using donated umbilical cords, there's no harvesting, so there's no drilling into bone, anything like that. So you are taking a needle, but most people can walk away. Most people do just, let me rephrase that. Everyone that we've done so far has walked away, gotten in their car, and gone about their activity of daily livings with very, very minimal pain. How long will it last really depends upon you. Again, what I think sets our office apart is we are uniquely qualified to coach you on the correct things to do, including diet, to get the most out of this that you can. But I will tell you from the papers that we're looking at 5 to 7 years from the studies in this country, 10 to 15 years from studies that have been done in other countries where it's been going on longer. But how long it will last will really depend on you. So what should I expect? Typically, it takes, again, I still tell people it takes about 6 to 8 weeks to really start to see a difference. 6 to 9 months is the sweet spot, but with the new things that we're doing, the combination things that we're doing, we're seeing results much, much faster. But what you should expect will depend again on your individual case, and then we'll discuss that during the consultation. Now, I put this in here because I think it's funny, but I think a lot of you kind of get fire hosed because we don't take a whole lot of time during this webinar. And we cover an awful lot of information, and a lot of you are probably feeling like this guy right here drinking from the fire hose. We understand that. We're just doing our best to keep it as short as we can. But here's the deal. What I want to share with you next is the next step, and that's to schedule the consultation. And if it's all right with you, what I'm going to do is I'm going to take the next few minutes. I don't know what just happened. I'm going to take the next few minutes and go through the offer that I've put together for you. I think you're going to like it. I think there's a lot of value in it. But the next step is, number 1, is to set up that consultation. I'm not going to charge you for that consult. We put a value on that of $125, but during that consult, we're just going to sit down together and discuss the areas of degeneration. We're going to talk about strategies, where we're going to put the injection. We want to give you options as far as the cost is concerned. We want to answer all of your questions so that we're all on the same page, and we certainly want your spouse involved when we do that so you guys can make a decision together. That is, if you have one. So that's $125 value. We're also going to give you a printed copy of our health handbook. We normally charge $59 for this, but this is the diet protocol that we put together. This is what I used for the first about 11 years of my practice. I got together with US Enzymes and put this together. It's a common sense approach to healthcare, but basically what this is a menus, recipes, and shopping lists for you to follow post-injection if you want to get the absolute best out of this. We're just going to hand you a copy of it. And yes, there are options for you to coach through it, or you can just follow the book as it's lined out for you, but we will give that to you. The third thing we're going to do is if you do stem cells, we're going to include the PRP injection with the stem cells. I think that saves you a lot. It saves you about $750 better by doing it that way, and it helps get results quicker, so I'm happy to do that for you. If you decide to do an IV on top of doing the stem cell injection, we will give you a 20% discount to do that. Again, that's another great value, I think. But we'll discuss those. We'll discuss those details at your consultation. The other thing that we're going to do is we're going to do something called PEMF and cold laser therapy for free. We're just going to add this if you make that consultation with us now. The reason why we add this is because there is research suggesting that both PEMF, which is pulsed electromagnetic field therapy, and cold laser have the ability to help the cells proliferate quicker. They help get stronger stem cells. So we're certainly going to help. We're going to do this for you on the day of your injection to help your injection go better, to get quicker results. So I've covered everything that I've wanted to cover with you. You guys have been awesome. We typically hang around for a few minutes and answer questions. I am going to turn the video off, but if you'll just hit that consultation button, set up your consultation. Let's just talk about what direction we need to go from here. You've been absolutely amazing. I appreciate you. With that being said, we're going to shut this off and again say thank you. Appreciate you being here. Thanks a lot.